In this video, we are discussing vitamin B complex family, which is a group of 8 water-soluble vitamins that play an important role in cell metabolism, energy production, nerve conduction, and many other functions inside the body. Earlier, it was believed that there is one vitamin B, but with the advancement in research, it was known that they are chemically distinct vitamins that usually coexist in the same food. So then these were named distinctly. Vitamin B1 is thiamine, vitamin B2 chemical name is riboflavin, vitamin B3 is niacin or niacinamide, vitamin B5 is pantothenic acid, vitamin B6 is pyridoxine, pyridoxal or pyridoxamine or pyridoxine hydrochloride, vitamin B7 is biotin, vitamin B9 is folic acid, vitamin B12 is cyanocobalamin. You see there are many forms of vitamin B6 mentioned here. These are the vitamins. Vitamins are chemically similar substances that have similar vitamin activity. When it gets inside the body, an OH group or chloride group or carboxylic group gets attached, or maybe it's reduced, there will be little bit difference in the chemical nature, but it performs the functions of the same vitamin from which it was derived. Okay, let's talk about the active forms of the vitamins. What are the active forms? It is the question. The active form means these vitamins are substituted, reduced or oxidized to form a coenzyme inside the body, and in this way it is used by the body to perform the functions like they play a role in the metabolism. The active form of thiamine is thiamine pyrophosphate TPP. You see, vitamin B2 riboflavin, its active form is flavin adenine dinucleotide FAD. Vitamin B3 niacin, its active form is nicotinamide adenine dinucleotide or its reduced form with having a hydrogen group, hydrogen ion in it, or it may be in the form of nicotinamide adenine dinucleotide phosphate or its reduced form. These all are active forms used as coenzyme inside the body. Vitamin B5 pantothenic acid, its active form is known as panthenol. Vitamin B6 is pyridoxine, its active form is pyridoxal 5-phosphate, abbreviated as PLP or P5P. Vitamin B7 biotin, its active form is biotin. B9 folate, its active form is methyl tetrahydrofolate or folinic acid. Folinic acid is another name of tetrahydrofolate. It is also used as dihydrofolate, but the more important is tetrahydrofolate. Vitamin B12 cobalamin, its active form is methyl cobalamin. Another active form is also there, which is known as 5-deoxyadenosyl cobalamin. Recommended daily allowance. Vitamins are recommended it's a quantity which should be taken by the men or women. It's recommended by some authentic sources, and this is in tabulated form in front of you. Vitamin B1 is needed in men per day 1.2 mg, and in women it's needed 1.1 mg. B2 is needed 1.3 mg, 1.1 mg in women. Vitamin B3 is needed 16 mg and 14 mg in women. Vitamin B5 is needed 5 mg in men and 5 mg in women both. Vitamin B6 is 1 to 1.7 mg in men and women both, and vitamin B7 is required in very minute quantity 30 mcg and 30 mcg in women. Vitamin B9, which is known as folic acid, it's required 400 mcg inside the body, both men and female. Vitamin B12 is required daily amount is 2.4 mcg in men and women both. RDA, this is consulted from various authentic sources like research papers and reference books. The RDA values are more or less same. Say for example, if thiamine is 1.2 mg in men, in one book it's cited as 1.3 mg in another book, so that's not a big difference. These recommended values are good enough to be consulted. Sources. Best sources are whole grains like wheat, corn, barley, which is the main ingredient of our daily food, potatoes, banana, chili peppers, yeast and pulses. All kind of pulses and all kind of grains contain vitamin B. all kind of vitamin B. Whole grain flour contains B vitamins, but refined flour and polished rice are deficient, as milling results in loss of B vitamin. This is an important thing to be considered before using the whole grain flour or refined flour. How these B vitamins improve the quality of life, let's overview it quickly. First of all, it improves the brain function. Vitamin B6 and B12 improve memory, lower anxiety and stress, and aid in treating the depression. Vitamin B12 improves the nerve cell function and boosts the nerve cell regeneration. And neurotransmitter synthesis is also there by the vitamin B complex, so it's important in brain function. It promotes the heart health. Folic acid and vitamin B1 and B12 may help reduce the risk of heart disease and inflammation. It enhances the immunity. Vitamin B6 and folate play an important role in synthesis of DNA and repair and promote the immune function. They also produce WBC, white blood cells, T cells, and other things in proper amount, so good immunity is ensured, and it reduces the risk of anemia. All of you know that B6 and B12 help in red blood cell production, and a very important thing, it increases the chances of a healthy pregnancy. Vitamin B6, B9 and B12 prevent the birth defects and reduce the risk of preeclampsia and promote the fetus health. All kind of neural tube defects are prevented by taking the folic acid. Vitamin B6 pyridoxine in tablet form, maybe you know, it is available in as the trade name NVP. NVP is used to treat the morning sickness, which is characterized by nausea and vomiting in the morning. So in this way, it improves the quality of life of pregnant ladies. So these are the diseases listed which arise due to deficiency of these vitamins. First of all, if we see vitamin A deficiency, it causes night blindness. Vitamin B1 thiamine deficiency produces beriberi. Riboflavin B2 deficiency produces erybofflavinosis, which is the skin, in which skin is affected. Skin cracks and itching, and dermatitis is there around the mouth, on lips, and on genitalia. B3 is niacin, and its deficiency produces pellagra. B5 is pantothenic acid, its deficiency causes paresthesia. Pyridoxine deficiency causes peripheral neuropathy. Biotin deficiency causes dermatitis, hair loss, and some other things. Folic acid deficiency causes megaloblastic anemia and birth defects, which are called the neural tube defects in the newborn infants. B12 cyanocobalamin, its deficiency causes the megaloblastic anemia as well. Okay, if someone asks that what are the symptoms of overdose of B complex vitamins, so the B vitamins are water soluble, and these vitamins are not stored inside the body and excreted in urine daily. Hence, it is highly unlikely you may overdose on B complex vitamins. If very high doses of supplements are taken, then these kind of the symptoms may be there, like abdominal cramps, nausea, diarrhea, increased urination, and excessive thirst, blurry vision, or some other. In this way, the doctor should be consulted, and symptoms may be subsided by taking the correct dose or discontinuing the supplements. That was all brief overview of B complex functions, deficiency diseases, and chemical activity. If you want more detail, keep on watching my channel. I have discussed these vitamins one by one, making separate videos on each. Keep on watching my YouTube channel RX Farm Academy, and keep on liking the videos and subscribe my channel and share it in your friends and fellows more and more you can. Till next time, goodbye.